What is female genital mutilation? FGM is the ritual cutting or removal of some or all of the external female genitalia. This is carried out by a traditional circumciser using a blade. FGM is conducted anywhere from days after the birth right down to puberty and beyond. There are three main types. Type 1 is the partial or total removal of the clitoris and/or the prepuce. Type 1A involves the removal of the clitoris hood only. This is rarely performed alone. The more common procedure is Type 1B, the complete or partial removal of the clitoral glands and clitoral hood. Type 2 is the complete or partial removal of the inner labia, with or without the removal of the clitoral glands and outer labia. Type 3 is the removal of the external genitalia and fusion of the wound. The inner and or outer labia are cut away, with or without removal of the clitoral glands. The vagina is opened for intercourse and opened further for childbirth. The data. Around 200 million girls and women around the world have been subjected to one of the three types of female genital mutilation. 91.5 million women and girls over the age of 9 currently suffer from the consequences of FGM. It is estimated that 3 million girls in Africa are at risk of being subjected to female genital mutilation each year. It occurs in around 28 countries in Africa and in some countries in Asia, Central and South America, and the Middle East. Increasing migration has increased the number of women and girls living outside their country of origin who have undergone or are at risk of FGM. FGM has no known health benefits. It is known to be harmful to girls and women in many ways. It is painful and traumatic and causes several immediate and long-term health consequences. Severe pain. Cutting the nerve ends and sensitive genital tissue causes extreme pain. Proper anesthesia is rarely used. The healing period is also very painful. Long-term chronic pain can be due to trapped or unprotected nerve endings. Excessive bleeding, hemorrhage, and septic shock have been documented. Shock can be caused by pain and/or hemorrhage. Infections may spread after the use of contaminated instruments and during the healing period as well. In the long term, can develop chronic pelvic infections that can cause chronic back and pelvic pain. Urinary tract infections can ascend to the kidneys, potentially resulting in renal failure, septicemia, and death. The psychological consequences. Many women describe FGM as a traumatic event. It can produce fear of sexual intercourse, post-traumatic stress, anxiety, depression, and memory loss. Quality of sexual life. Removal of or damage to highly sensitive genital tissue affect sexual sensitivity and lead to sexual problems, such as decreased sexual pleasure and pain during sex. Scar formation and traumatic memories associated with this procedure can also lead to such problems. Men suffer pain as well, and the sexual intercourse can be literally impossible to make in some cases. Reproductive tract infections and sexually transmitted infections, an increased frequency of certain genital infections, including bacterial vaginosis, an increased risk for genital herpes, an increased risk for bleeding during intercourse may also increase the risk for HIV transmission. Birth complications. The incidences of cesarean section and postpartum hemorrhage are substantially increased. The risks increase with the severity of the female genital mutilation. To the newborn, higher death rates and reduced APGAR scores have been found. Death can be caused by hemorrhage or infections, including tetanus and shock. Why this happens? Female genital mutilation represents society's control over women. Communities that practice FGM report a variety of social and religious reasons for continuing with it. It is supported by both men and women, usually without question, and anyone departing from the norm may face condemnation, harassment, and ostracism. It is difficult for families to abandon the practice without support from the wider community. In fact, it is often practiced even when it is known to inflict harm upon girls because the perceived social benefits of the practice are deemed higher than its disadvantages. False statements. A belief sometimes expressed by women is that FGM enhances men's sexual pleasure. Female genital mutilation is also considered to make girls clean and beautiful. Even though the practice can be found among Christians, Jews, and Muslims, none of the holy texts of any of these religions prescribe FGM. Seen from a human rights perspective, the practice reflects a deep-rooted inequality between the sexes and constitutes an extreme form of discrimination against women and violation of the rights of the child. Is a violation of human rights. However, despite some successes, the overall rate of decline in the prevalence of FGM has been slow. There is still a lot to do. The actors for change. International institutions play a crucial role in providing international standards and promoting and undertaking research. United Nations agencies, such as WHO, are particularly well placed to promote cooperation and coordination among all actors. Development cooperation agencies in supporting international and national initiatives by providing technical and financial support is also essential to achieve the common goal of ending FGM. Governments. Several governments have passed laws against the practice, and where these laws have been complemented by culturally sensitive education and public awareness-raising activities, the practice has declined. Parliamentarians have a critical role to play in bringing the issue of FGM into policy debates, as do the legal and judicial sectors in setting and enforcing norms. Professional organizations, such as medical associations and nursing councils, can promote ethical guidelines in medical training and in practice. Teachers, lawyers, social workers, and others can also contribute within their respective fields. Healthcare providers must never perform female genital mutilation. They can play a key role in preventing FGM and in supporting and informing patients and communities about the benefits of eliminating it. National and international non-governmental organizations. They have been key actors in designing and implementing programs for the abandonment of female genital mutilation. The most successful programs have been community-based. This is true in countries of origin, as well as in countries where FGM is practiced by migrant communities. Inclusion of community and national leaders, both religious and secular, at the level of the community as well as at the national level. Such leaders who are at the forefront in advocating the abandonment of female genital mutilation play an important role in both providing arguments against the practice and generating social support for change. Communities that have employed a process of collective decision-making have been able to abandon the practice. Indeed, the practice can be eliminated very rapidly. Men are important for change. In some settings, they support the practice. However, some men are concerned by the effects of FGM and would prefer to marry women who have not undergone the procedure. Young men in particular are more likely to oppose the practice. To all the men, you don't even want to imagine what is the equivalence of FGM on a penis. Nothing to do with male circumcision. Traditional circumcisers are key actors. They might be resistant to such change as it can threaten their position, and they may use their influence within the community to continue to promote the practice or undermine efforts for abandonment. On the other hand, if they decide to abandon the practice, they can be very forceful in convincing others to abandon it also. Families. Inside them is where the decision is taken. Many families are unaware of the harm they do to their daughters. And with the education and information, they can be made to see that FGM brings nothing but suffering to their daughters. Families think that they're doing something good for the girl. Young people. It is also important to include young people, both girls and boys, as they are often more open to change and can themselves be important change agents. Taking action for the complete elimination of female genital mutilation. Concerted action from many sides and at different levels is needed, from local to global, and involving sectors such as education, finance, justice, and women's affairs, as well as the health sector. Programs that are led by communities are by nature participatory and generally guide communities to define the problem and solutions themselves. Are non-judgmental and non-coercive. They focus on encouraging a collective choice to abandon FGM. It requires a significant number of families within a community to make a collective, coordinated choice to abandon the practice. Programs that include empowering education, discussion and debate, and organized diffusion have been shown to bring about the necessary consensus and coordination for the sustained abandonment of FGM at community level. Schools can offer a forum for learning and discussion about female genital mutilation. Intergenerational dialogue should be explored when designing initiatives to address FGM. Public discussions can stimulate discussions in the private, family setting, where decisions about genital mutilation are made by parents and other family members. Through a strategy of organized diffusion, communities that are abandoning the practice engage others to do the same. As female genital mutilation is a manifestation of gender inequality, a special focus on women's empowerment is important. Listening to them is very important. Survivors are a key vector for change. We should give them protection and voice. Encourage them to break this nonsense practice and her associated taboos and false statements. Express, explain, expose, expulse FGM.